Hello, this is Dr. Joe Garri from Mosa Plastic Surgery. Welcome to episode number 6 of the Surgeon's Corner podcast. Our topic of discussion for this episode is a procedure called Cheiloplasty, particularly as it relates to the correction of lip deformities caused by silicone injections. The term Cheiloplasty has its origin in the Greek word cheilos, which means lip. The term means the restoration of lip form and function as usually performed by either plastic surgeons or oral and maxillofacial surgeons. Cheiloplasty is not a specific procedure per se, but encompasses a multitude of surgeries to correct different lip congenital and acquired problems, such as cleft lip, asymmetries, notching, etc. One of the contemporary applications of the term involves the correction of lip deformities caused by silicone injections. Injectable silicone is a synthetic product with FDA-approved ophthalmological indications that for years has been used by certain practitioners off-label as a filler material for cosmetic applications. The term off-label means that the product in question has not been licensed by the Food and Drug Administration or the FDA for that particular indication or use. Although some practitioners and injectors insist that silicone injections for this cosmetic indication are safe, particularly when used in minimal amounts with a micro droplet technique, there are many others, including myself, who advise against it due to the many complications reported from its use, some of which include allergic reactions, the formation of painful granulomas, migration of silicone into other tissues, etc. One particular complication seen in a significant number of patients is a chronic foreign body reaction which leads to anatomical deformation of the tissues into which the product is injected. This tissue distortion can also occur in adjacent tissues due to product migration. The use of fillers for restoration of volume or for treatment of facial wrinkles due to tissue loss, like for example in the nasolabial creases, is an accepted and common aesthetic treatment modality. There are a multitude of injectables that are currently approved by the FDA as fillers. Most of these products are biodegradable and thus temporary, as for example hyaluronic acid, the main ingredient of many commercially available injectable fillers. Injectable silicone is different from these other products in that it is not biodegradable and thus permanently remains in the tissues into which it is injected. The use of this product is also a much cheaper treatment option. Indeed, it is the reduced cost that makes this treatment option so appealing to many patients, who unfortunately are at times treated by unlicensed practitioners and are often just told that they are being injected with a polymer or a biopolymer. For its part, the FDA has issued warnings against the use of injectable silicone for cosmetic use and especially against receiving treatment with non-medical grade products by unlicensed practitioners. Although silicone injections might be safe for some patients, for others it is not so, as the safety profile of the product is not optimal. The silicone oil acts as a foreign body when injected, so it triggers an immune response which in some patients becomes exacerbated over time. In this subset of patients, this immune response can lead to the formation of painful granulomas or excessive reactive scar tissue formation that can distort the tissues wherever product is injected. Moreover, as this product is known for migration throughout tissue planes, this tissue distortion oftentimes occurs in areas removed from the injection sites after the product migrates to those areas. This distortion of the tissues is particularly concerning to patients that have had silicone injections to their lips, as the thin, pink lip mucosal tissue is particularly susceptible to distortion as a result of this foreign body reaction. As this process is highly irregular, it leads to hypertrophic or enlarged lips, which slowly lose shape and ideal anatomical contours. Moreover, as this foreign body reaction continues as long as the product is present, the tissue distortion gets progressively worse over time. Patients who experience this progressive distortion of lip contour often become very distraught and are driven to seek help in ameliorating or reversing this process. Proper communication with said patients is crucial, as it is very important to explain to them the process causing the lip distortion, the potential options available for treatment, and the importance of continued follow-up post-treatment. When silicone is injected into the fat in certain areas of the body, as in the buttocks for example, the removal of that fat through liposuction will decrease the amount of product remaining in the tissues. and usually leads to an amelioration of symptoms as the product load in the tissues becomes less. Injections into the lips, however, presents a significantly different challenge as there's very little fat in the lips and the product is directly injected into the muscle in the tissue plane deep to the mucosa of the lips. Thus, in the lips, liposuction is not a viable treatment option. Rather, the product needs to be excised surgically in order to reduce the biologic load. This means that in order to remove the product, the affected tissue needs to be removed as well. Moreover, total removal of the product by resection is usually impossible, as it could lead to an unacceptable tissue loss and result in significant anatomical deformities. Cheiloplasty is a procedure in which the excessive tissue in the lips is removed with the dual purpose of restoring size and anatomical contours of the lips, while at the same time decreasing the biological load or amount of the product in the tissues. This procedure is usually done in an office setting with local anesthesia, with or without mild sedation. After local anesthesia is injected, an incision is made in the junction of the wet-dry mucosa of the pink portion of the lip called the vermilion. Through that access incision, the hyperplastic or excess tissue in the lip is removed and contoured. After this is done to the surgeon's satisfaction, the incision is closed, usually with resorbable sutures. As the resulting suture line is placed in the wet-dry line of the vermilion, it is hardly visible and usually leaves a thin, imperceptible scar. In counseling patients who are candidates for cheiloplasty, I often stress that it's much better to be conservative rather than aggressive when it comes to tissue resection during contour, as it is much easier to revise the lips in the future with further resection if needed, rather than having to add volume, which might necessitate the use of fillers or grafting procedures. Patients are further advised that the lips are very vascular structures and this can cause significant swelling post-cheiloplasty. Thus, a period of 6 weeks is necessary prior to the assessment of the results before a decision is made as to whether any revision is necessary. This 6-week period of time is recommended as to allow for all the surgical associated swelling to completely dissipate. Patients should also be made to understand that although the removal of the hyperplastic distorted tissue decreases the biologic load of the silicone in the remaining tissues, some of the silicone oil will by definition remain in the unresected tissues. This means that the foreign body reaction process will continue indefinitely and there is always the possibility of continued future tissue distortion, necessitating repeat cheiloplasty or other adjunctive procedures months or years after the initial treatment. Patients are further counseled that since this tissue distortion occurs in 3 dimensions, one potential distortion that sometimes needs further management is when the upper lip grows in a vertical dimension, leading to an elongated upper lip that does not offer proper tooth show at rest and at full smile. If this problem persists despite a properly performed cheiloplasty, then a subsequent lip lift procedure might be indicated. This particular procedure, which will be the subject of a future podcast, will decrease the total length of the upper lip, leading to proper tooth show both at rest and at full smile. It is also important that the patients are advised that since they are prone to an increased foreign body reaction to the injectable silicone, they should refrain from using this product in the future, but rather use biodegradable fillers or fat grafting when and if the need arises. For patients with significant distortion status post silicone injection to the lips, more than one intervention might be necessary. Once the lips are finally brought into better proportion and contour, it is important to follow the patients indefinitely, at least on a yearly basis, so as to address any further anatomical deformation as early as possible. Thank you very much for your time and attention. This is Dr. Joe Garri, and I'll see you in the next episode of the Surgeon's Corner podcast.